Hello everyone, this is Dr. Mohid and today we will be discussing about Decubitus ulcer. Not a very long topic but just a few points that we need to remember in this. First of all, what is the cause of this? Only one thing, that is these are the bed sores, right? Why do we have bed sores? Because prolonged immobilization, right? Because of prolonged immobilization, there could be any reason, the patient could undergo paralysis or XYZ reason, the patient can have something like a Decubitus ulcer. First of all, we also need to know how to treat them. That is one thing, yes, and what are the staging method, right? That is important. These 2 points are very important regarding this chapter. Alright, so let us just begin. Decubitus ulcer. Alright, so what is the main reason of having Decubitus ulcer? This is also called as a pressure ulcer. Alright, so for example, this is the sacral bone, and for prolonged duration, the patient is just lying straight on the back. So what is happening is, because of this, yes, because of immobilization, so there is continuous pressure. So what is going to happen is the capillaries on that area will be occluded, right? If the capillaries are occluded, what's going to happen? Necrosis, right? There will be necrosis because there is no supply for blood, no oxygen is there. So eventually it undergoes necrosis. Alright, so it could be superficial, it could be deep, it could go up till bones, right? Bones and muscles could be involved as well. So everything we will be discussing here. First, we just discuss about it is also called as a pressure ulcer. Alright, and because of that, what do you think? If the pressure is here, will the ulcer be like on the back, on the hand? What do you think will be the location of the ulcer, right? The location will be only at the spot where there is elicitation of pressure, right? That is the only spot. So the very hallmark thing is localized ulceration. Alright, that is one thing we need to remember. Alright, fine. And the most common one that we find is because of the bony prominence. Yes, we just discussed this point. That is because of the bony prominence. Okay, fine. It is also called because of the continuous pressure. Okay, so what is the problem which is happening here? Because of all this pressure, in all these stories that is happening, immobilization, and because of the pressure, because of all these reasons, what is happening is the capillaries are being occluded. Okay. Alright, which results in ischemia and finally necrosis. Okay, so what are the risk factors? Yes, there is a list of all these things that we have. So but the main risk factor, it is immobilization, prolonged immobilization. Alright, yes, that can be because it could be because of nutritional deficiencies, neurological disorders such as dementia. Why? Because of this is the person is not able to take care of himself. Yes, it could be just like just isolated at one spot and not able to know what is actually happening, and increased moisture in that area, which causes more proliferation of the bacteria on the epidermis, right? Because of the shearing forces, this is the same point we discussed regarding the pressure, right? Because of the shearing forces, the reason that is, okay, fine, in a patient who is lying flat and everything is normal, there will be ulcer in his buttocks, right? But if there is shearing force at some other location for any other reason, yes, so even at that location the presentation will be the same, pressure ulcer will form. Okay, alright, so clinical presentation, it varies according to the patient, right? It is not the same. But first we should go and see these images. Yes, you see here. Yes, you see here, this is a very serious, yes, it's very serious, and the treatment aspect also we will be discussing as well. So you can see the little muscle, so the epidermis, dermis is gone. Epidermis, dermis, hypodermis all gone. You can see the muscle, right? So Please remember this, and I'll ask you which staging is it. So staging we'll just discuss in 5 minutes, so we can use this image and over there as well. Over here you see the same type. Yes, over here you see. Yes, there is such a punched out lesion. The punched out lesion is there almost, right? Okay. You see, and also I just want you to notice about this erythema which is there, right? This erythema which is there, this is the stage 1. Okay. First this erythema comes, the redness comes, the non-blanching erythema, that is what it comes, and then later on we'll have stage 2, stage 3 and stage 4. Alright, fine. We'll come to that in a while, but first, how is the presentation going to be? What are the few points that I want you to keep in mind? That first of all there is erythema. Alright, we just discussed about this. Alright, and at the end, what is the, like as simple as erythema, some like just redness, just redness across an area. Yes, it could have extensive involvement such as necrosis. Yes, it could lead to necrosis. Alright, yes, so that could be the presentation. Definitely it will vary according to the patient and patient, how at what location the patient has the ulcer and everything. It will be depending on the patient as well, but this thing will be common, like how the disease will progress. This is what I want you to remember. This is what I was talking about, the staging. Okay, so first of all we have intact skin with non-blanching areas. Yes, non-blanching erythematous areas would be there. Okay, fine, we just go on to these images straight up. Yes, so you see over here, this is where the just in the epidermis erythema will be there. This is the stage 1. Yeah, in dermis you see the dermis is involved in the stage 2. Okay, but in the stage 3 there is hypodermis. Yes, the fat layer is involved as well. Okay, now in the stage 4 you see there is involvement of bone and muscle. Okay, so the bone and muscle are involved in stage 4. It's a very severe condition, but yes, we should remember like the individual findings of it. Okay, so this is just the epidermis, this is the dermis, and hypodermis is also involved, that is the subcutaneous fat, right, that is involved in stage 3. So we should just know the highlighting words of all these stages, and then we are all good to go. Alright, so let us just continue, fill up our notes. So stage 1 would be what? Intact skin with non-blanching redness or erythema. Alright, non-blanching. I hope you know the meaning of blanching, non-blanching. It is just that, for example, there is an erythematous lesion, and over here I just push, right, I just press on the erythematous area. What is going to happen is, if there is continuous presence of the red area, so it will be called as non-blanching. Alright, and if I press it and okay fine, the area is white, right, the skin turns normal color, so that would be blanching. Okay, fine, so blanching and non-blanching, two things are there. So this is non-blanching. Alright, how about the stage 2? So this was stage 2 was partial loss. So the first time the epidermis is lost. Okay, and so partial loss of the epidermis with superficial ulceration will also be seen. Okay, so in stage 3 what is happening, there is full thickness loss, alright, of the epidermis. Okay, so of the till what do we see in the stage 3? The very peculiar word about stage 3 is we will see subcutaneous fat, right, subcutaneous tissue would be visible. Okay, it reaches till there, subcutaneous tissue and fat would be visible. Okay, and but what is a very classical point over here, that over here also we saw, right, the stage 3, do you see there is involvement of muscle and bone? No. Okay, so please keep this in mind, that it is only limiting till the fat area, the subcutaneous tissue and the fat area which is there, the adipose layer, it is only limiting till there, it is not continuing to the muscle and bone. So that would be the point we will write over here, not So if over here if stage 3 with the muscle and bones are not involved, so in which stage they will be involving? Stage 4, right? It's very simple. So the tendon and bones are involved. Okay, so pause. Okay, continue. Bye. Continue. That is about the stage 4 would be tendons or bones. Okay, so what is the most important thing? Like, when you have this patient, everything is there, everything is done, but what is the most important thing is to have a proper examination of the patient. Okay, to have proper examination, we check the whole presentation of the patient. Okay, fine. Do we see any other erythematous base so that we can prevent the progression of the disease, right? Then, if fine, we have an ulcer. So what we will do is we will take a tissue sample, yes, and we will culture it, right, to see is there any growth of any microorganisms. Yes, that is this point about. And yes, we would do, if there is bone involvement, we would do a biopsy, right? We would do a biopsy, or either we would go for an MRI to rule out what? To rule out osteomyelitis. All right. So we can take a biopsy and we can culture it and we can see if there is an infection in the bone to rule out osteomyelitis. Okay, all right, that is one thing. How about the complication? Yes, definitely there will be permanent skin damage. So I am not expecting something like this to just heal everything normally. Yes, that is one thing. So permanent skin damage will be there. Okay, how about the next point? Yes, so what was happening is there was an absolute open access, right, to the tissue, right? There could be development of sepsis. Yes, as simple as sepsis could develop. Yes, and it is a very dreadful condition to have, that is sepsis. Okay, osteomyelitis, yes, we just rule out that by doing an biopsy or MRI. Alright, we just discussed that point. How about the marginal ulcer? What do you think is the predisposition of marginal ulcer? Question number 1. Question number 2, what cancer does it predisposes to? Let's answer the question number 2 first, that is squamous cell carcinoma. Okay, marginal ulcer, we use which classification? We use the 𝗖𝗵 classification, right? It is very important point as per all the exams are concerned, right? So this is very important point from surgery. Okay, what are the reasons, yes, that could elicit to this? It would be chronic skin trauma. So whenever we read about marginal ulcer, okay, fine, we only have one thing there. Okay, fine, it will be burns. Yes, burns are there, but chronic skin trauma, if there is if you see in the MCQ, so it is not a wrong option. Okay, that is the reason I mentioned this here, that it is not a wrong option. So if on a skin, right, continuously by years and years for because of 𝗲𝗵 reason, right, there is an abuse because of any insult. Yes, so it definitely has a predisposition of developing squamous cell carcinoma. All right, that is one thing we have to remember. Over here you see there is cyst formation, right? You see there is this marginal ulcer, right? Marginal ulcer, the 𝗲𝗵 classification which is there, that is also mandatory to be memorized, to be known, right? We should know all the stagings in it. I'm not discussing over here. Okay, how about the management? Yes, so what do you think the management would be like? Generally talking, about it. What will be the mainstay? Yes, do I need to give some medicine, or I don't know what or what not? The mainstay of the treatment would be just continuous repositioning of the patient, right, so that the skin which is there, it can get some blood supply. Yes, so the capillaries which are blocked, they could get the capillaries, the vascularity would be increased, right? That is one thing. Okay, frequent repositioning of the patient. Right, from here to there to here to there, right? We will just reposition the patient every time. How long after how much duration that we should do it, that is 2 hours. Yes, so we should do it every 2 hours, which is there. Okay, so but regardless of the staging, 1 2 3 4, regardless of the staging, we have to do it, like we have to do it. Okay, that is one thing. Yes, we would optimize the caloric intake and the nutritional status of the patient. Definitely we'll have to take care about that. How about the treatment options? Yes, so what would you do to the stage 1 patient? So we would just advise the patient for repositioning, right? Okay, repositioning. That was about the stage 1. How about the stage 2? What do we do in stage 2 is occlusive dressing. We would do something called as occlusive dressing. Okay, all right. What is this? How does this look like? It will look like this. Yes, so what are we trying to do? We put a gauze piece over there, right, and we are trying to elicit a pressure, right, on the wound. Okay, fine. This is called as occlusive dressing. Okay. How about the stage 3 and 4? Definitely we can do surgical debridement would be there, like if something has reached to this level, so surgical intervention would be necessary, right? Okay. Stage 3 we would do surgical debridement. Alright, that would be the mainstay of it. Okay, and what two things that we are supposed to know over here, that is the hyperbaric oxygen therapy. Okay, this is very important. We should know this, the hyperbaric oxygen therapy. Okay, and what, okay, let me just show you the image. What is this? Do you guys know this one? What is this? What are we doing here? We are doing negative pressure wound therapy, right? So what are we doing is, because of this, we just we put this apparatus and we create a vacuum, right? Because of that, there is negative pressure on the wound, which increases the healing. Okay, all right, negative pressure therapy. All right, so fine, we just done with the management part, right, of all these things. So let us just go ahead and see the images. What was this? This was the negative pressure wound therapy, right? Okay, how about this? So over here you see this is a ulcer, right? Definitely over here you can see, over here we can see the epidermis, dermis is involved. I can see also see some muscles, and definitely there is fat involvement, right? Definitely there is stage 3, almost stage 3. Yes, which is there. Over here you can see a very slight, healing you can see over here after applying negative pressure therapy. This is how it reached up, and we have the last and the second last one. See, at the end, this is what the body could grow back, the skin, right? But definitely if the patient was not this, without intervention, it is impossible to have these results. Okay, this was the, over here we have the occlusive dressing, right, over here, as we discussed, right over here. Okay, how about this one? Person looks very comfortable over here, that is one thing. Yes, this is not a tanning machine. Okay, if you are thinking about a tanning machine, this is not that. Okay, this is called something called as an hyperbaric chamber. Definitely what does this mean is, in the normal room environment, right, so what is the percentage of oxygen? That is 21% of oxygen it is available, right? But over here 100% oxygen is available in this room, right, in this capsule. Okay, so this promotes healing. Yes, that is one thing. And because we can, our lungs get the 100% oxygen, so there is optimum utilization of the RBCs. Yes, so promoting the growth. Okay, all right. How about this one? This is the same. Definitely he is watching, all right, some new channel. Okay, all right. Fine. So that is all about the decubitus ulcer. Yes, a very short topic and nothing much in it, but just a few points, stages and treatment, and the images. If you are good with, definitely it is just as a very simple glide through topic. Alright, so thank you so much for listening.